Hi, I'm Ed Highland. This is ASA TV, and I'm joined now by Dr. Jeffrey Plagenhoef, who is the ASA First Vice President. Thank you so much for coming by and joining us today.
Pleasure to be here.
Let's talk about advocacy. Very important. Give us some idea of why it is so important for ASA members to be involved and be advocates.
Well, at this point in history, healthcare is changing more rapidly than ever. I don't think that's a secret. Many people are telling their story, and not very many people know ours. As a matter of fact, about 66% of the population doesn't even know anesthesiologists are physicians, and they don't know that CRNAs are nurse anesthetists. So it's people are talking about who should be doing what on a daily basis in our state capitals and in Washington, D.C. They're talking about how healthcare should be remodeled. But the problem is we have a lot of people opining about what needs to be done who have never practiced medicine, who don't know anything about it. They're interested in saving money, they're interested in quality. But the ideal levels of quality and safety cannot be maintained as we re-engineer healthcare without having the people who provide it involved in deciding what is safe to cut and what isn't. So at this point in time, we have a lot of mid-level providers, as a general term, or advanced practice registered nurses, for instance, wanting to practice independently. There's a national effort to give nurse practitioners independent practice and full prescriptive authority. Now, they also don't know what they don't know. Basic fact, you don't know what you don't know till you learn it. So they see things through their filter, which is the nursing education filter. It's very important for everybody to realize the difference in nurse training and doctor training. The average advanced practice nurse has about 1,600 to 1,800 hours of clinical training. The average physician has between 12,000 and 16,000 hours of training. So you can look at that one way or another. They have about 15% of our training, or if you look at the total number of hours, we have 800% more hours of training. Dramatic difference. Now, I like to appeal to intellect and just common sense. We ask people all the time, if that is the difference, how could one reasonably say that there's no difference between a nurse practicing medicine and a doctor practicing medicine? There's a huge difference, but most people don't know it because they're not educated as physicians. They can't see the big picture. So we have to advocate for our specialty, to tell our story, so that we are executing our responsibility to always put patients first. There's no higher priority for the ASA than patient safety, and we will not allow patients to receive anesthesia care in this country, or perioperative care, or acute critical care without physician involvement.
Building on that, could we talk a little bit about which areas of the specialty are most affected by the government?
In today's world, all areas of the specialty are affected by the government. Unfortunately, it's a reality of what we deal with. So whether you're looking at quality and safety, again, our highest priority, very affected by the government when you have people like Bill Clinton leaving office saying that nurses should practice independently. That happened years ago. So there's a government intervention right there, just throwing out the importance of physician-led team-based care. They are affecting payment. We've got new legislation that's going to revolutionize in a greater degree than ever before the way physicians are paid. So if physicians aren't involved and at the table there, they'll be on the menu when it comes to payment. It doesn't matter really what you're looking at. The way care is delivered, how it's paid for, it's being decided in the nation's capital and in the state's capitals, and we have to be there to provide our expertise on what changes are acceptable to improve value, where value is quality divided by cost, and what changes aren't. It's our expertise that's needed more than most others.
How do you get members involved? How do you get folks, what can they do basically to become greater advocates?
Great, that's a great question. If you have the perfect answer, I'd like to learn it. I've been working towards that goal for a couple of decades now. The problem that we face is physicians aren't naturally prone to becoming involved in politics. We are science-oriented. We learn about science in undergrad, med school, and in residency, and then we get out into the real world and realize question number two, what is the government doing to affect us? Everything. So we have to start educating physicians. We started doing that at the residency level about 7 or 8 years ago, having residents be taught about the importance of advocacy, helping them learn the yearly habit of giving money to our political action committee. A lot of people think that that's just, unprofessional and a dirty practice, giving political donations, but it's the reality of the American system. It's the way laws are made. We have to develop relationships with people on Capitol Hill. It costs them a lot of money to be there, and you need to support the people who are good, that get the big picture, that vote for the right things. So if you want to have access to people on Capitol Hill or in your state capitol, you have to help them stay there. You got to help people, and it costs money. You can't have an advocacy program that's not funded. It just doesn't work. So we try to make sure that all anesthesiologists are aware of the very clear reality that there isn't one person among us that doesn't share that responsibility equally. They need to understand that it doesn't matter who you are, where you practice, the type of your practice. You owe it to patient safety, you owe it to quality of care, you owe it to the medical specialty of anesthesiology, you owe it to your paycheck, you owe it to everything that comprises what we do to pull your fair share of the load, time-wise and financially.
Dr. Plagenhoef, thank you so much for your insight.
Thank you for the opportunity to speak with you.
This is ASA TV.